It gives me great pleasure to introduce our next speaker, Dr. Benoit Philippe. Dr. Philippe is a doctor of medicine, and he's a specialist in stomatology and maxillofacial surgery. His private practice in Paris is dedicated to pre-implant skeletal reconstructions and maxillofacial osteotomies. Dr. Benoit Philippe is full member of the French Society of Stomatology and Maxillofacial Surgery. He's a member of the International Association of Oral and Maxillofacial Surgeons. He's a member of the French Association of Implantology. He's also a member of the French Language Facial Cleft Association. He's the teaching head in numerous universities in France and abroad. Dr. Benoit Philippe has authored more than 100 national and international papers on implantology and maxillofacial surgery, and he has also written several dozen publications. He has contributed to several books on implantology and maxillofacial surgery in English. Please join me in welcoming Dr. Benoit Philippe.
Assalamu alaikum. Good afternoon, ladies and gentlemen. Many thanks to the scientific committee to invite me here. I'm very honored. Oh, I will do again. Assalamu alaikum. Good afternoon, ladies and gentlemen. Many thanks to the scientific committee to invite me here, and many thanks and congratulations to the organization team for the remarkable professional job to organize this event. I am a private practice medical doctor and maxillofacial surgeon in Paris. I do bone graft for implants, osteotomies for orthodontics since 20 years. And I do computer surgery since 12 years. It's a great honor for me to share my experience here today with you in this great city as Dubai. 12 years ago, we started computer graft for implantology, as you can see here, and we are satisfied of the result. This is a 12-year result. We use Simplant software since 10 years with simulation, diagnosis, control of the execution with the stereolithographic guides for the good experience and a good result. We use also computers for bone cranial harvesting for reconstruction, and we are very glad of that for secure. This is a traumatic case I did 10 years ago. You can see on the upper corner, on the left side, the atrophic, the reconstruction with bone graft from the cranium, the results 6 months after that, and the implants. And you can see here the result with 10 years. That's what we did before, that we continue now with zirconium technology too. We use also computers for cranium harvesting bone for good security, good efficiency, and good result, as you can see here. We need to know the thickness of the cranium, and we need to know the density of the cranium to perform a soft surgery. We use many times, all time I would say, Simplant computers for the diagnosis of the atrophic jaws and also to confirm the reconstruction, so we can give to the dentist, to the implantologist and the postdodontist good bone volume to do good restorations. That's the aim. You can see the result here on the upper jaw temporary bridge. The patient, our patient with the referees, has 2 years temporary bridges, and we do definitive bridges after 2 years of healing concerning the bone and mostly the mucosa to have nice papillas. Then we can rebuild to the lower jaw and finish the case. This is very classical. We use that since 10, 12, 20 years, depending the cases. I must say thank you to my friend, Dr. Philippe from Dubai. He is the first in the world who invented the totally assisted computered implantology. He invited in 2002 the SAFE system, and he described it very clearly in French Review in 2003. He is a leader. In 2005, I was working on the skeleton because I am a maxillofacial surgeon, and we could load the plaster model on the cranium on the maxillary image in 3D. And this is the first case, never been in the world, of a totally edentulous jaw with put-in implants simultaneously to osteotomy of the sagittal splitting. I did this case 5 years ago. We'll talk about that later on. We use always computers and implants for bone harvesting before surgery. We can do what we want on the chin. It's very easy. It's technical. But with implant, we can know the anatomic variation, as you can see here. And we need to take care with the chin because there is a vascular risk. We can have the ending of the lingual artery, communication between lingual artery and dental artery, and musculature insertion. Take care. We also use a posterior mandibular harvesting site for ramus. So we can take a lot of bone. And we are very happy to have computers. We can check the nerve risk, the vascular risk for the nerve, for the arteries. We can check the dental risk concerning the roots. And mostly the fracture risk, mostly if we work on edentulous jaws and we use third molar impacted area to harvesting bone. All those cases has been described and published. This is a quite huge case, a complete atrophic jaw. We can simulate the implants, the bridge, then we simulate the bone graft, then we do the bone graft, and then we check. And so we can do the implantology in good conditions. 12 implants, putting implants, preparing the bridges before surgery, immediate loading, and the patient goes out with the teeth. This is my referee coming working with me in the operation room. We also use it with alveolar clefts. This is not my case before, it's my case now. The patient comes to see me like this with a mother, please doctor, give me implants and a good smile. But look at the 21 tooth, it's no good. We remove it, we do bone graft, and we put implants. Thank you to computers, and thank you to Simplant. We use also tibial harvesting site for all those type of clefts. A little scar, 2 centimeters, we repair everything, we build the bone again, and we close the cleft. We can put implants, and we can have a nice smile. That's the way, that's the aim. Sometimes, very rare cases, I perform distraction when it's good. This case has been done with my friend Dr. Philippe from Dubai. 5 weeks for surgery, then scanner, computers. That's the tool of your congress here today. That's why I'm here, to speak about surgery and computers and software. And then my friend Tadio put the implants, and this is the result after 3 years of loading. Look at the bone structure, which is more dense now around the implants. Rejuvenation surgery is the most interesting way of my work. Nearly 30% of my patients come all over the world having a rejuvenation smile. There's no teeth, no bone, and I need to do it again. This is a 6-day result. Here again, the same woman, after 6 days of surgery, no lifting, no Botox, no everything, just bone, 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 and bone again. 3 years after that, the same profile.